Only 43% of Texans are fully vaccinated. That's according to data from our state's health department. As Delta variant continues to spread, many are wondering, do you still need to get vaccinated if you've had COVID? Dr. Linda Yancey, an infectious disease expert with Memorial Hermann, joins us live now to further discuss this. Good morning to you, Dr. Yancey.
Good morning.
Well, let's get right into that very question, because we've heard that statement from actually a lot of our viewers who say, I've already had COVID, I have the antibodies, I don't need a vaccine, not going to do it. What is your thought with the science behind that?
So unfortunately, even if you've had COVID, you do still need to get a vaccine. When the immune system is fighting off COVID-19, it's doing two things. It's saving you from it, and it's building long-term immunity. When you get the vaccine, the immune system only has one job, and that's to build long-term immunity. Your immune system is always going to prioritize saving you.
One thing that has just made us sick to hear just in the past few weeks is doctors coming out and saying it's breaking their heart that they're putting patients on a ventilator, and the last thing they hear from the patient is, can you please give me a vaccine? And the doctors are saying it's too late. That being said, for people who do end up surviving COVID, how long do they need to wait after they're fully recovered to consider getting that vaccine?
I would get it as soon as possible after you're fully recovered. Now, you don't want to get a vaccine when you're still taking steroids, so wait until that you're done taking those, but then go out and get the vaccine. It's available for free at any pharmacy.
When I woke up this morning, the first alert I saw on my phone was a warning from the CDC that calls Delta, this variant, as contagious as chicken pox. And you try to picture that before we had the chicken pox vaccine and how quickly kids were spreading it to each other. What is up with this Delta variant? Why is it so much more contagious? Is there any rhyme or reason of what's going on with this one?
So this variant produces so many more virus particles per minute than the older COVID-19s. So it's producing 1,000 times more viruses that can spread through the air. That's why it's so contagious.
One thing that I'm having a hard time with as a medical reporter is viewers asking me, why are you guys pushing the vaccine so much? Why can't you find a doctor who is against it, or just give this a little more balance? And to be honest, as a medical reporter, Dr. Yancey, I haven't found one medical expert really in the country who says don't do it. Can you explain more for our viewers who are holding out, who are tired of hearing us say every day and talking to doctors who say it's really important to get that vaccine?
So vaccines are not new. They've been around for 200 years. The science behind them is solid. Vaccines work. They prevent death, they prevent illness, and that's why we are all advocating for them. I would so much rather see folks get the vaccine than see them on ventilators in my hospital.
And then people are saying, well, I have plenty of friends who've gotten sick from the vaccine. Are you hearing that it's still under 1% of people who have serious side effects from the vaccine? Because that's the numbers that I keep seeing come in from the CDC.
A handful of people in a million will have serious side effects. Most folks will feel a little cruddy for a couple of days. Most everybody gets a sore arm, but believe me, a sore arm and a couple of days of fever is so much better than ending up spending weeks in the intensive care unit.
All right, Dr. Yancey, thank you for your time from Memorial Hermann today.
Have a good one.
You do the same.